your questions about masks, booster shots, the Omicron variant every day. And as the only local TV station with a doctor on staff, we know who to turn to for answers, and it is our own Dr. Mallika Marshall who joins us on this Monday. Doctor, we want to start with a question from Alan, who writes, I purchased a 50-pack of KN95 masks on Amazon. It has the GB2626-2019 on it, but not on the masks themselves. Are they fake?
Yeah, so to make sure that they are legitimate, you definitely want to see the GB2626-2019 or GB2626-2006 engraved on each individual mask, not just on the packaging. If you'd like some more tips on how to identify fake masks, you can go to our website at cbsboston.com.
Okay, I'm definitely going to do that because I have never looked for the number. Robin wants to know, Mallika, if 4 people in my house have COVID at the same time and 2 turn negative before the other 2, is it possible that the 2 who now test negative will get reinfected?
No, I mean, if all 4 got infected around the same time and 2 of them are now negative on rapid antigen tests, they're not going to get reinfected by the people who may still be testing positive on those rapid antigen tests. They probably all got infected with the Omicron variant, and they're building up immunity, and they shouldn't get reinfected with Omicron at least for several months.
Okay, and this is a question from Cynthia in Ipswich. She asks, seems like all we hear of is Omicron. Has Delta disappeared? Does individual testing differentiate between the 2 variants?
So the PCR test that you and I get and the rapid antigen tests that we're often doing, those aren't going to tell you exactly which variant you're infected with. You need sort of special laboratory tests to distinguish between those 2, which scientists are doing all over the country. But I can assure you that virtually all new infections are actually due to the Omicron variant right now.
Okay, and here's a question. We're going to shift gears just a little bit, Doctor. Mary asks, when the flu hits and it turns out that the current flu vaccine doesn't provide as much protection as hoped, why don't they just make a flu vaccine booster like they're doing for COVID?
You know, it's a really good question. First of all, the coronavirus and flu viruses are actually very different. And as we know, the influenza virus that causes the flu mutates frequently. And so over the summer, scientists make sort of their best guess as to which strains are going to be circulating in the United States in the wintertime, and they make a vaccine to address those strains. Some years it's a good match. Some years it's not such a good match. And it also takes time to sort of determine whether the vaccine that they've made is a good match to what's circulating. Plus, it can take up to 6 months to actually manufacture and mass produce flu vaccines, which is really too late to address any flu in any given flu season.
All right, Dr. Mallika Marshall, thank you so much. Dr. Mallika offers her best advice, but as always, consult your personal doctor before you make any decisions about your health. And if you have a question for Dr. Mallika, there are 3 ways you can reach her. First, email drmallika@cbs.com. You can reach out to her on Twitter @Mallika Marshall or Facebook message her, Dr. Mallika Marshall. Paul?